This is what so that application policy interface with the platform. It's also intended to be a space for building your own custom models, but sounds like each other. But the interface is working with the coding system. So yeah, the output of your model can be represented like a consistent output decision for supporting this patient story.
Huomenta.
Not that far, and yeah, like this customs shoulder. But I would say we do want to done line up where you sometimes end up taking it's one of the more principles of the practice in training. Any journey with and then how it actually builds upon the so pulling from the using leveraging all the existing.
See, yeah, we also have locally in one piece, so I highly recommend to stay here and learn about that.
But so I guess one thing you could do. Better than looking for it. Yeah. That's what you want my opinion. I don't see why not. Yeah, it's a lot of your own.
I'm happy. Yes.
Näin tässä sinne kutsun ostakaa sanoin
Shall we get started? Hello, everybody. Welcome to Finland, where we are punctual, and it's now 9 a.m. sharp. So we'll kick off the hackathon. Can I get some woo? Woo, that's a woo. So awesome to see also all the seats filling up already. We do have the other room, the 203B, next to us. So when we actually start the hacking, we have some more space, although we may have some more participants then as well. The health data hackathon, Finnish health data hackathon, is part of a series of Nordic health data hackathons, and all of these are organized in collaboration with HL7 affiliates, HL7 Finland, HL7 Denmark, HL7 Norway, and HL7 Sweden. And we take turns 4 times in a year. So in first quarter, it's Finland. Second quarter in Vitalis, it's Sweden. And then fourth quarter in Norway, it's EHIN, Electronic Health in Norway. And in autumn, it's in Denmark, and we don't know the event yet. But anyway, we are planning to make this a continuous cycle of hackathons taking place 4 times per year. And this instance is sponsored by City of Helsinki, IHE Catalyst, and Sensotrend, and it's made possible by dozens of volunteers. And if everything goes smoothly, we are happy to take credit. If everything doesn't go smoothly, then please step in and make it go smoothly. So not too much professional effort in producing this event, but we still believe it's going to be a massive success. Some logistics. We do have the 30 years symposium of HL7 Finland taking place at the same time just below us. And we are organizing something together with them like coffee and lunch. So after this opening, we'll all go down and have coffee with the audience of that symposium. And then we come back and separate between 2 rooms. So you are free to work on your own, but I guess you get the best benefits if you collaborate and work with somebody. And we have the 2 tracks, the patient access track and care plans track, or care plans and clinical reasoning. And the idea is that mainly the patient access track is on this room, and the care plans clinical reasoning track is on the next room. And I checked, there's better equipment there. There's ice water there. So if you get thirsty, you actually need to go to the next room, or then we get hot here as well. Regarding coffee and lunch, they are covered for you. You need to take this kind of a fire sticker and wear it prominently when you enter the restaurant Platta around noon. So if you wear a fire sticker, then they won't invoice you for the lunch. If you want to support us, you can pay for your own lunch, but it's covered for you if you want. Remote participation is possible. So there are 2 continuously running Teams meetings. I tested them before and they seem to work. I tested them this morning and something seems to have happened with the room 203. So there's actually the lobby function in place. I didn't put it there. I'm not sure what happened. If there are some problems accessing that Teams meeting, please let me know and let's try to fix it. Any questions so far? Then I thought, let's introduce the tracks briefly. I can start with the patient access track. So plenty of initiatives here, and you can find it's fire.fi/hackathon is the website for the event that I'm pretty sure most of you have visited already because you managed to register and find this information. We have some presentations listed here for the patient access track. So there are different initiatives. One is the challenge by City of Helsinki. We have a separate presentation on that just after coffee at 10. There's money available, money prizes, and City of Helsinki basically wants to see apps connected to their MISA patient portal and patient app. Then there's generic presentation of smart app launch in general. So yes, MISA is one EHR you can connect to, but the same mechanism applies to dozens of other EHRs. And we take a look at the spec and how to use it, and open source libraries available. And then one big thing is the digital identity wallets. So EU projects like XShare, My Health and My Hands, and perhaps I2X are using this session to synchronize their views on how, to work together with digital identity wallets and how health data goes there. And then we have other presentations coming on. So please take a look at the schedule. We might even update it during the day. And I'm part of that track, but let's introduce some other people. So Jyrki and Tero are from City of Helsinki, and Kaisa too. And Juho is from Apotti, and Jari are from Apotti, so the EHR Epic-based one. And Sean is from Epic. Is Nick here? Well, yes, Sean and Nick are from Epic. Who else? I think that's good for City of Helsinki and Smart App Launch. Then there's me and my twin brother, Samuel, working on digital identity wallets. So Samuel works on Findi, a Finnish infrastructure operator for digital wallets. And we have some other people joining as well. And Nicole, I saw, yes. And was Sophia, yes. So also part of digital identity wallets. I think that's it. Then patient access track. Jonathan, do you want to introduce that track? No, the care plans and clinical reasoning. Sorry, too many things going on my mind right now. I'll go there.
That would be helpful. All right, so the other track, care plans and clinical reasoning. I know the scope is broad, maybe even huge, but it follows in a similar vein as the patient access track, in the sense that there is quite a few presentations and hands-on sessions on Monday, and more of a free-form hacking day on Tuesday. But please don't take that as gospel. This is a hackathon, so the idea isn't that everybody is expected to listen and be involved in every single session. But if there is something that interests you, then please feel free. And if you go through all of these as well, there's both care plan sessions in the AM. First, Morten is going to be presenting on the care plan work in Denmark, and then a similar session from Turkey as well. These are following the XShare project work that is currently ongoing on the topic. Then we're going to be heading for a lunch, and after that there is going to be more of a shift towards the guideline side of things. So first a hands-on the WHO smart guidelines, and afterwards we're going to be using some LLMs and AI to transform a Finnish COPD guideline from L1 all the way to L4. Well, a partial thing, not the whole guideline. That would be a bit too ambitious. And after the coffee, we'll be finishing off the sessions by preparing an implementation guide. But as I mentioned, yes, please feel free if you find an interesting topic that's not related to care plans, that's not related to guidelines. For example, if you are working on CDS hooks or Smart or some other CDS system, for example, there's plenty of interesting people here around. So find a topic and hack away. you're more than feel free to do that. Let's not go over to Tuesday agenda yet, but I'd like to introduce at least Adam, my co-lead, if you can make yourself known. Adam from Norway, working on, I can't pronounce it. It's the medication catalog, right? Fellskatalogen, yes. And Adam has already before this hackathon, before this session, published an example based on the Finnish national risk medication, a CDS service based on that. So that might be an interesting thing to look at. I have also made available some synthetic data based on the CinderEye project. If you need any of that to work on your own hacking, and all of that stuff can be found in the chat.fire.org or the Zulip channel for this Finnish health data hackathon. And I think if there are any interesting things or other repositories, things like that you wanna post, I think that would be the perfect place for that.
Let's introduce Morten and Giorgio and Catherine also on that table working on the care plans. And Mikko Tiihonen also part of preparations of the care plan tracks. The care plan activists. Thank you, Jonathan. Our original plan with the 2 rooms was that we have 1 room for presentations and the other one for quiet hacking and collaboration and that kind of stuff. We failed with that plan. We have too much content that people want to present. Well, now we are experimenting with presentations on both rooms. And the point is that let's present in a moderate voice so people further away from the podium can still hack, and then we don't have any amplified audio, and we can also stream and record the presentations, and we'll just see how this goes. And if it doesn't go, then we'll figure out something else, but now we have presentations in both of the rooms. The tables, you can take those apart and move them if you want to work in separate groups of 12 or 4 people or whatever. And there are also places in the hallway when you wander about, there are some nice sofas and even kind of shared spaces where you can also go to collaborate if you want to do something in a smaller group. And any advice and ideas regarding how to make the presentations and hacking go well together, highly appreciated. Anyway, tomorrow there's a lot more time for presentation, for hacking, it seems. What more thing? Results. So the City of Helsinki Challenge, that's for 24 hours. So we have demos at 10 a.m. tomorrow, and then the celebrations or the awards ceremony in a different location, the City Hall at 6:30 tomorrow. And then we are still figuring out what's the actual time for presenting the results of the hackathon to both the Radical Health Festival and the Doctor Days. That's starting when Radical Health ends. But that should be Wednesday, late afternoon or evening. Any questions so far? Toilets you can find down the hallway. Jyrki did some reconnaissance, and I think the closest toilets are when we go to the coffee and next to that. Any questions? Everybody ready? Do you know what you'll be hacking on? Let's do some hacking.
Mitä erikoista yritit Helsingin? Se on vain yleisesti mahtavampi sinne maiseen.
Joo, se on 10 on erikseen brief.
Tai se onkin se, joo.
Järjellä on sellainen esimerkki, se on esimerkkiä tai sulla on.
Mä oon jakanut Jarin esimerkkisovelluksen jo, mutta
Joo.
Jari voi esitellä sitä kyllä. Hello, everybody. Just some kind of a reminder. We have the City of Helsinki Challenge presentation right now. So if you're interested, come closer. We won't be amplifying the audio. So yes, City of Helsinki is looking for apps to connect with the MISA patient portal. That's how MISA looks like, to get you familiar with the identity of MISA. And really the point is that there is an underlying Epic installation. So Apotti is running Epic in Finland, and Epic has pretty good user interfaces and APIs to connect third-party applications to that system. And we all share the vision that it would be grand if there would be dozens and dozens of different apps for patients and also for clinicians. So just like mobile phones nowadays are platforms for apps, EHRs would be platforms for apps. So a health system or individual clinic or an individual clinician might install their own app and optimize a workflow for them. And in this challenge, the focus is on patient-facing apps. So not so much for the clinicians, but what patients could actually use. And MISA is the patient portal. So feel free to present any kind of ideas that you think might be useful for individual patients. There is a webinar recording on this, and mainly on the Epic part and how to connect with Epic. There's an online sandbox that you can register to, and you can do all of that with that guidance. There's also another thing. Well, I'll show that in the next presentation. That's the smart app launch. So how that actually works in practice. Essentially, for this challenge, we have evaluation criteria. So this is what the esteemed jury will be looking at. What are the benefits of the application that's integrated? What's the implementability, so to say? So how easy and risk-free it would be for City of Helsinki and Apotti to make that integration. If you say that, hey, we want to give patient full access and they can delete all of the information from Epic, that's not good. But if you say that, hey, we just want to read this small part information that the patient anyway has access to, much better chances of succeeding. So implementability, how much technical work there is, how much process work, and kind of how much does the healthcare need to do, consider those and try to make it as easy as possible for them. Ease of use then, so of course the judges want to see user-friendly apps, not just engineering stuff made by engineers for engineers. And then engagement, so some kind of guarantees that this is not something that people just download and never use and doesn't lead to anything. do focus on those on the presentations. And the presentations will be in exactly 1 day, so starting 10 a.m. tomorrow morning. And there's the jury, so pretty high level people from City of Helsinki judging your entries. And woohoo, there are prizes. So the winner gets 2,500 and the second place gets 1,500 and there's 1,000 euro for the third awardee. And just for clarity, Sensotrend will be also demonstrating, but I'm disqualifying Sensotrend from the prizes, so we won't be accepting any monetary prizes. We may accept a honorary mention or something, but I've been so involved in setting the rules of the game, so I won't be playing myself. Any questions so far? Then I would ask all of the participants interested in this challenge to let us know, because we need to set the time frame for presentations. And initially be prepared to pitch your idea in 3 or 5 minutes. We'll see how many entries there will be, but I think 5 minutes is the absolute maximum time that you will have, and it might be that you just have 3 minutes to present your idea to the judges. And don't be alarmed by that, but do take into consideration that judges are really looking for all of these 4 things, and you should be able to communicate them. Hey, this brings massive benefits. Hey, it's really easy to implement, doesn't take anything from you, and look how nice it looks, and yes, it's really engaging. That's your main message to the judges. And then when you're on site, do talk to these people, City of Helsinki, Apotti, Epic, and have them convinced that yes, it actually works, show the technical integration and so on. So you don't necessarily need to prove the technical integration to the judges, mainly the present the idea tomorrow, but the technical integration, you can work with people here today on that, and then also in that ways raise the confidence that yes, this can be done and this could be done and this should be done. We happy with that?
Yeah.
Any questions from online? If not, that was my main message. Let's keep hacking. Okay, another short presentation starting on Smart App Launch and how to work with that. We already had a webinar related to this earlier. So we have the patient access track info, and we also have the Helsinki Abbott Epic subtrack info, and this takes you through the Epic sandbox and what you can do there. And now building a bit on top of that and sharing some additional resources that we have. So those resources are, if you go to results, because we want to publish these results also for others later on. So we have the results page, and here we have the patient access page. So we have plenty of presentations, for instance, and videos for Fire Dev Days. That's an awesome developer conference for Fire people. And we've curated some of the presentations from there that are related to Smart App Launch. So that's of course nice, but who has time for webinars? We of course want to see this in practice. And so one of the examples is the Fire client JavaScript client library that you can use, works both on browser and on server implementations. And there are app examples on Abbot's GitHub page. Jari is here who's been working on this. So there's, I guess, 4 different implementations, and all of those open source. You can start with those and start building your own implementation. Or if you face some challenges, you can look at how Jari solved those. And then there's also open code sandbox example where you can actually work around and play with these things. So here, if you initiate the launch here, I'll take you through the process. Then this is where you actually go to MISA and sign in with suomi.fi, the Finnish national identification system. But here we are on Epic Sandbox, so we're just signing in via JSON in this sandbox environment, logging in. And now we get a warning that somebody has leaked the password of this public test user. I don't care too much about that. Here you can select whether you're logging in as yourself or a proxy to somebody else. Let's log in by myself as Jason. And now in this app example, I haven't done all of the checks that are available in Epic Sandbox. So there I could actually fill in questionnaires and explain how my app uses the data. With this test app, I haven't done any of that. So we get a notification that, hey, SensorTrend hasn't told us how it uses your data. Okay, I'm pretty flexible because this is not my data. This is Jason's data. So I say continue. And after that, I get even more checks. So here, this is again, we are in Epic Sandbox, and similar, you would be in Abbott. So here you can even on resource level say that, hey, I don't want that app to have access to like my demographic information or something. So I can select based on these. And because I've selected in the Epic Sandbox all of the available APIs, this screen becomes really long. And this also is an indication to the patient that, hey, this app is really accessing all of your information. However, I've also implemented some smaller apps with a limited scope, and there you might also only have 1 or 2 questions. Okay, do you allow this app to have access to your vital signs, for instance? There is a possibility for the patient to go even deeper. So here's the kind of more detailed description of each of the data sets, what does it actually mean. And then there's also the individual resources. So you could even go here if you're really nerdy and knowledgeable, you could select that, hey, I want the app to have everything except for this specific API. You can do this kind of selection here. And this also visualizes that, hey, the app is really asking for a lot of stuff. So you can do that kind of really find fine-grained selection as a patient if you want. And then I've asked for offline access token. So now the portal asks, okay, do you want to give your information to this app for 1 hour, 1 day, 1 week, 1 month, 3 months, 6 months, or 1 year? And I said, no, I just want to test it out. I don't want it to have access to my data for too long. So just one hour and allow access. And then you get back to the test app. And here in the test app, you can see that, hey, we got the patient information and current user. That's the same as the patient in this case. If I would have selected a proxy option, then FireJSON would be the current user and the current patient would be the actual patient. And there's some other information as well, and no errors in this case. So that's just a simple implementation. And then I should actually also show you because I watched the webinar from Epic, and there I didn't see the actual smart app launch presented, and now I think I need my other phone for authenticating there, so bear with me a minute. But here we actually can test it. Log in. And yes, that I need to do. Am I not sharing the screen? Why wasn't I sharing the screen? Thank you, Peter, for telling me at this minute. Yeah. Okay. Now I'm sharing my screen, and now we are in Epic Sandbox, and I'll show you the patient access flow again just after this. So where we actually get to test this is here. Get rid of the Teams stuff. Good. That's as well. Edit my Chrome window, go. Here. So here, documentation and launching your app from Epic. Here is actually the I tested this one as well. Now I just there's the try it link. So this is where actually get to try it, and here you select which app you want to test and which patient, and then enter the launch URL. This is something you need to know. That might be the right one. So I have many of these configured, so not sure whether this one works, but anyway, this is the place where, yes, it worked. So in from Epic Sandbox launch this. So there are two different launches, the standalone launch that I showed, and this was the EHR launch. You can test both. But yes, let's now go back to the what I was showing before. So we have the information on results page, and then it was this example, the client JS examples, that takes me to this code sandbox, and here I showed the access through this link and then logged in as pages, and I could actually change select a different patient this time and go there, and again somebody has leaked the password, and yes, I haven't disclosed anything, and this was the information screen, and then there's also the details and more options that I showed. And then, okay, let's give the app access for 1 hour. Allow access, and you get again here. Any questions? Everybody done this already? Not everybody. Yes, we can. Okay, let me know if you have any questions in the future. Thanks. Hi Alberto, buongiorno.
Hello, good morning.
Everything good there?
Yeah. And from your side?
Good. We have around 45 participants. I counted last. We are in 2 rooms, might be even more.
Excellent.
Congrats.
Thank you.
Yeah, indeed.
Are you able to share?
Yeah.
Yep.
Just let me know when we are ready and I can share some slides.
Yeah, you can already take the screen so people know it.
Excellent. Okay, so good morning, everyone. In the meantime, let me share my screen. Let me switch to the presentation mode. Okay, I believe you can now see my slide deck in presentation mode.
Yes, it's
Am
on
I
the
right?
screen
Thank
here.
you. And also the sound from my side is good, I hope.
Yeah, we are experimenting with that. So we have the same
Okay.
room and we have people who want to hack, and then we have these presentations. So I've asked people to come closer to my computer if they want to listen, or then they can join and use their own headsets to follow. But yes, you have good audience here in the room already.
Excellent. Nice to hear. So maybe do you want me to start, or we can wait for a
No, I
couple
want
of
you to start at even
Okay,
hour
okay.
because we've published the schedule and there might be people that are joining already.
Excellent. Excellent. So
So
again, good
take a break,
morning.
take a glass of water or something like that. So start in 3 minutes.
In 3 minutes. Okay,
Yeah.
great. Great.
Okay, now it's 11 o'clock here in Helsinki and 10 o'clock in most of the rest of the Europe. And the next presentation will be given by Alberto Zanini remotely. So Alberto, please take it away. Introduce yourself and the topic.
Thank you, Mikael. Good morning, everyone. Alberto Zanini is my name. Head of International Projects and European Relations in Maggioli Group, which is an Italian company. Thank you for the opportunity to share some information about the general principles of the European Union Digital Identity Wallet, on which I believe you will see during the day probably some more hands-on activity, but we thought it would be a good opportunity to share beforehand some, let's say, general principles in order to have the tools or the instruments to hopefully better understand the other activities that are planned for the day. So without any further ado, let's start with my presentation. It will last about 25 minutes or so. I'm in presentation mode, so I can't see any question in the chat, so just feel free to step in case of some clarifications are needed or some questions arise during the presentation. So the general discussion that we will be having today is about the landscape of the digital identity, which is pretty mature in the European Union. As you can see from a recent investigation, so to speak, we have more than 100 different digital identities solutions developed by either the public sector or the private sector in the Union and among the European Union member states. If we had to enlarge, let's say, a bit our investigation in the physical territory, the physical soil of the Europe, we would have more than 200 solutions deployed, which means the market is very mature, but as a possible, let's say, consequence, the need for the interoperability is there, because as underlined several times by the European Commission and also by the political, let's say, goals of the State of the Union of the Europe, the EU citizens should be able to use their digital identity for accessing public services or private services deployed in Europe, regardless of our country affiliation. So let's say I'm a citizen from Italy, I should be able to access an online service offered by Finland without requiring a digital identity released by Finland in order to do so. We will see some more details about the wallet at a later stage. I would like to mention that the wallet is not the first attempt, is not the first initiative in which the Union has tried to promote this approach. There is still running and fully operational another initiative, which is called eIDAS Login, operational since, I believe, 2016 or so. Which is a network of different identity providers deployed in Europe. Is still operational, fully functioning. It has some limitations, so to speak. The first one is that this eIDAS login infrastructure is devoted just for the online service, not for the offline, not for the proximity service, so to speak. The other limitation is that the only allowed services are the public ones. So the private dimension is not allowed to join this network. So the some sort of interoperability is there already, fully operational, but we wanted to achieve some more, let's say, degree of interoperability involving, for example, the private sector. And this is one of the reasons why the European Digital Identity Wallet was proposed several years ago. The idea, as I said, is to provide a digital identity interoperable by design, let's say, promoting a common approach in the 27 member states, of course, according to specific technical standards. This proposition is aligned with the ambition of the EU Digital Compass, recently published, I believe, last summer, last August, if I'm not mistaken. And one of the proposition is having 100% of us as European citizens having access to a digital ID in 4-year times. The EUDI wallet will store these widely accepted and interoperable electronic identity. And doing so, we would also allow the citizen to manage their digital identity securely. And this is very important and is not allowed by the current eIDAS login, disclosing just the necessary information required by a consumer, which is called relying party. We will see some more details later. As I said, compared to the eIDAS login, we will have some improved features, for example, the access to the offline service, for example, in a proximity mode, alongside the online services, which is already offered today, including, as I said, the private services, for example, banks, just to mention a simple example. The wallet will be free for use for us as European citizen and on a voluntary basis. So we will not be forced, let's say, to use the wallet, but we will be able to do so if we want to do so on a free for use scheme. The timeline for adoption is delined here. From, let's say, a political standpoint, the process started almost 2 years ago with the formal adoption and the approval by the Parliament and the Council. Then we had the so-called implementing acts, which are documents, so to simplify, pretty technical, that defined the overall architecture and some technicalities behind the wallet initiatives. And then finally in 2026, we will see some deadlines here, I believe in the next slide. This year we will have the first deadlines. Deadlines are mostly for the member states, and which means 24 months after the implementing acts. In 2027, we will have some more deadlines involving also the private sector. So the overall idea is to have a mature, let's say, landscape involving both the public and the private sectors by the end of 27. With some more details, each member state in Europe has to develop, and this is the obligation, has to develop its own implementation of the digital identity wallet, and another obligation is to integrate this into the existing infrastructure of the services offered to the citizens at home and abroad. We have 2 milestones, as said. The first one is approaching by December 26. All the member states must provide a wallet app for free, as I said. This app is, of course, built to uniform specifications, free of charge, as I said, to citizens, residents, and businesses. And by the same date, this is also very important, the online public services deployed in Europe must accept the wallet as an authentication method for user. It's not required that the wallet is the only authentication method in order to authenticate the users, but it's required that the wallet would be introduced as an additional authentication method for users. So, for example, let's say we have a member state, for example, Italy, that deployed already 2 well-established authentication means. This obligation does not require Italy to remove the already existing authentication methods, but it requires instead to add the EUDI wallet as an additional authentication tool for the citizens. 1 year later, by December 27, we will have the similar obligation, but for the online private platform, for example, banks, as I said before, that must support wallet as authentication method for the users. So as we can see, the deadlines are approaching, and there is a wide community working on that in order to achieve the expectations. Wide community involving mostly the member states, but not just them. I propose here just 3 examples among the more than 27 probably different deployment decisions or deployment strategies that the Union decided to adopt. For example, and all of them are quite different between the other. For example, Germany decided to promote a competition to the market in order to select their implementation of the EUDI wallet, public EUDI wallet that, remember the deadline, must be deployed by December 26. Cyprus had another approach with some early adoption incentives for willing citizens willing to try the first implementation of their wallet. Italy decided to proceed in a different way, building up on already existing app, which is well established and deployed across the country. And on top of that, we have the reference implementation deployed, funded by the Union and developed by Skitales, that I believe you know very well. And the member states have also this additional opportunity, which means they can take the reference implementation developed by Skitales, which is again available for the member states, and they could, if they want to do so, deploy the reference implementation adapted, let's say, to the national needs to their citizens. We have at least 3 main features offered by the wallet. Starting from the left-hand side, the first one is probably the intuitive one, is the identification and the authentication of the owner. The second one is the presentation of the so-called attributes. We will spend some words on this in the next slides. The third and last one is the digital signature. And let's see some more details starting from the identification and authentication. But before that, I would like to spend just a couple of words, at least to be all aligned on the terminology, which is pretty complex in the EUDI wallet ecosystem. As I said, just a couple of words about some key roles on the EUDI wallet landscape. The first one is the EUDI wallet instance, which is to simplify the app, which will be installed on a mobile device belonging to the user. The second one is the PID provider. Again, we will see some more details, but the PID provider is the entity which releases a PID, which is the key container of the personal identification data belonging to the user. The trusted list register, which is the repository of the trusted entities that are allowed to work with the wallet and are recognized, and are recognized between the issuer's role and the relying party role, and finally the relying party or consumer or service provider. I believe we will see some different terms with the same meaning. But the relying party is the official one. The relying party is this consumer of the attribute. For example, is the consumer of the personal identification data released to a wallet and belonging to a user. As I said, the pretty straightforward, I would say, feature. The first one is the identification and authentication. Each wallet instance will have a person identification data, which is a structure, a technical structure, containing some key data belonging to the user, let's say to simplify name, surname, date of birth, etc., and many others. It is created during the onboarding phase and is typically derived from another government-issued ID solution already deployed maybe in the member states. The PID structure, as I said, is stored in the wallet and can be presented to a relying party which needs to access to the data belonging to the wallet user. Again, very important, the selective disclosure feature, which means the user will have the possibility to share just specific attributes. Let's say I want to access an online service offered by a member state which requires just the proof of age, which requires just a proof of that I'm over 18. There is no need to send to this service my name and surname. I just need to share my date of birth, for example. And this is the selective disclosure principle. It's not available today in the current eIDAS login deployment infrastructure. As I said, the idea or the expectation is that the member states will not get rid of the already existing and well deployed maybe solution, identification solution available in their countries. The idea is that the wallet will be introduced as an additional authentication means, as an additional offering, let's say, for the users. We mentioned already the possible online or offline use. So the user will have the possibility to work with the wallet in an online setting, in a remote setting, which is let's say the usual behavior of us as a citizen accessing an online service via browser. The other possibility is to use wallet in a proximity setting, in a physical proximity with a counterpart. So the relying party could be supervised or not supervised. So we may encounter another user supervising a relying party in physical proximity with us. And in this case, we as a user will have the possibility to use the wallet also in the proximity setting. The experience could be on the same device, which means in the very same mobile device, I have my wallet installed, but I also access the relying party in my very same device or cross-device, which means I have my wallet, I use the wallet as an authentication means, but the service, the relying party, is offered on another device, for example, on a browser installed in a laptop, let's say. Another very important feature is this one is the presentation of the attributes. Again, this is not available in the current solutions, in the current EIDAS login scheme, so it deserves a specific attention. Maybe the first step is to provide you with a definition of an attribute, which is pretty simple. It's a piece of data, so it's again a technical component. It's a piece of data containing some contents. It is digitally signed and is provided by an issuer, which is one of the roles that I highlighted in the previous EODI wallet overall scheme, so to speak. An attribute is a digital document that confirms a specific piece of information, let's say an attribute about a wallet user or an entity. These attributes are prepared and issued by a public or private provider, and these attributes are stored in the wallet, and can be shared with the consumers, with the relying parties in case of need. There are different types of available attributes according to the wallet specifications. The first one is called electronic attestation of attributes. The second one is called qualified electronic attestation of attributes. And the third one is the public qualified or not electronic attestation of attributes. As you can see from the name, there are, let's say, 3 different flavors with different also requirements for the issuers. And some examples of attributes in general without qualifying them as public or qualified are, for example, the following: the mobile driving license could be an attribute, a diploma, a certificate of residence, but also an health data, for example, a prescription. Another technical detail, which is pretty important, is that the issuer is the entity supposed to prepare, signs, and release the attribute, but the actual data are retrieved from another entity, which is called authentic source. To understand a bit more the difference between these 2 entities, if the attributes is a diploma, we may assume that the authentic source is a school or a university, or in case of the mobile driving license as an attribute, the authentic source is some government authorities, which has the actual data belonging to the citizens and related to their mobile driving license. Last but not least, the digital signature, again, not available in the current EIDAS login. Each wallet instance is equipped with a private key, able to sign documents. after possibly a preview to the user, in order that the user is aware, of course, of the document that is about to sign. The private key can be stored on the mobile device or in another secure storage, for example, in an HSM, which is pretty technical, depending on the certification scheme. A practical example, using the private key installed on the wallet, a user could sign a consent form, for example. There are a lot of standards and technologies involved in this ecosystem. Maybe just to mention that the QR codes, the QR codes are pretty familiar for all of us since the pandemic times. The QR codes are used for the device engagement in order to create the trust between the wallet and the consumer, the underlying party, or vice versa. They are not used for carrying actual attributes. The actual attributes are exchanged using different technologies, for example, NFC or Bluetooth low energy for the proximity use cases. The European Commission funded a lot of large-scale pilots working with the wallet in order to experiment a bit, and also to provide the Commission with some feedback about the, let's say, the feasibility of these specifications. So we had, for the time being, 2 different rounds of pilots. The first one involved 4 large-scale pilots, all of them concluded last year in 2025. From 2025, we have 2 brand new large-scale pilots, and as you can see from some keywords here, all of these 6 pilots, all of them are focused on different vertical domains, so to speak. So, for example, we have potential that focused on different use cases, e-prescription, among the others. We had no bid focus on the digital payments and many others. We build the brand new pilot is focusing on the business wallet. So a multitude, let's say, of different domains where the wallet can be introduced, and the Commission funded this activity again in order to gather some feedback also on the feasibility of the specifications related to the wallet. Coming now to our digital health domain, we have a lot of possible applications. We mentioned potential as a first large-scale pilot. This brand new project called My Health in My Hands. We have, I believe, many participants involved in this event in Helsinki right now, and I'm also part of this consortium. We are exploring ways of using the wallet for patients on both sides, on the authentication means side, but also for carrying as an attribute, as I said, in a secure way, the health data. At the same time, the health professionals might use the wallet in order to prove, for example, their affiliation with an hospital, or their role with their role. Both of them can be stored as an electronic attestation of attribute. And we may explore some additional discussion about the business wallet for institutions. This business wallet is not for the individuals, but could be introduced for institutions or hospitals, etc. For the health professionals, there is a clear statement on the European Health Data Space regulation, which requires the health professionals and their institution to use the wallet. I quote here from a frequently asked question related to the European Health Data Space, and I quote, "Health professional access service provided by public sector bodies or private parties will always have to accept the wallet where some requirements are met." So just to spread the message that the wallet is not just for us as European citizens, but also for some categories, especially health professionals is a very good example, also from some categories among the professional world. When it comes to the patients and leveraging the experience of the large-scale pilot potential, there are different ways for integrating the wallet. A first option that potential experimented already and we are leveraging on behalf of my hands is to use the wallet as an authentication means in order to simplify the process of identification of the citizen, especially when the citizen is having a medical encounter abroad. This medical encounter abroad setting is possible using a network which is called MyFTU. In MyFTU, for the time being, the identification phase is not, let's say, performed using electronic means. So we are introducing an additional layer of security and privacy using the wallet. Under the umbrella of the project My Effort, My Hands, we have just submitted it's called a change proposal, which means we have already, let's say, proposed an amendment to the current MyFTU setting in order to introduce the wallet as an additional way of authenticating and identify patients when traveling abroad. Another way of using the wallet is to present any prescription as an attribute. So we may have any prescription stored as a qualified or not qualified electronic attestation of attribute in the wallet, and we might want to present him to a consumer, to a online party. So we are going a bit in a different direction. Let's say we are not involving just the identification, but the actual storing of data as an attribute and the actual sharing of data. In this case, the data is the prescription. And we also working on that under the umbrella of the MyFTU initiative. There are a lot of possible anticipated or possible future cases in MyFTU. Again, in MyFTU is the cross-border setting of sharing data. For example, we might work on the access of the translated version of the patient summary, leveraging the outcomes of another project, which was called PAFID. As I said, the identification means and the change proposal was submitted in September 2025 in order to improve the identification phase of the citizens when traveling abroad. There is another possible important trajectory, which is the world of the online pharmacies. As some of us may know, the online pharmacies are now fully allowed by the HDS in a specific article, which requires the member states not to apply any discrimination between the brick and mortar setting and the online setting of the pharmacies. And again, the online pharmacies setting could be also a very good example for introducing the wallet for identifying the citizen, but under some conditions also for sharing actual data. And also the online pharmacy is another dimension that we are exploring in My Effort and My Hands as a European funded project. I believe this was my last slide, and it seems we are also on time. Maybe I can stop sharing my screen in a moment. In the meantime, Michael, and I don't know if we have some immediate feedback from the audience or some question in the chat.
Do we have questions here? No, we do have engaged conversations and chatting, and perhaps people already browsing and looking for information. So thank you very much for the presentation, Alberto.
You're welcome. Of course, these are my details in case of some further details are needed.
Thank you. We'll
Thank you.
continue to the next presentation.
Thank you. Have a nice continuation. Thank you. Bye.
Thank you.
So, but do I have to unmute myself on the Teams or not?
No, we can use your mic.
Can you hear me also on the Teams? Perfect. I'm sorry that you missed part of my presentation, but basically this is the methodology for the specification, and this is the testing strategy. We will see later the different types of events that we propose to the European projects. And here is the slide that I would like to share regarding the different types of events that we propose. Basically, for the European projects we are working on and we are creating the testing lab for, we are in the phase of the IT Plagathon that is very experimental and for test and use cases that are not yet mature or specific enough. It's informal. It is hybrid because we have also educational parts over there. Then we have the IT Connectathon that is very specific for IT profiles. So it's a very formal test on IT profiles, and we give vendors who test on the IT Connectathon seals. And then we have the Projectathon that is not an IHE branded testing event. Is a part of a testing event that is related to projects or initiatives, and it's very specific. You have to have very specific implementation to be tested. And you see in the slide that these types of events follow the IT testing continuum. So from a very experimental phase to a very, very specific and well-formed specification. And in the IT continuum, testing continuum, we have also the continuous testing session that we will see later, and you will be able to test with today. Type of testings. We have two different type of testing. The one you maybe know them. The first one is no peer testing. You will test without live partners, but will with validator and simulators, and peer-to-peer testing that involves two or more real systems. So you can exchange data and validate interoperability with other partners. And this is to recap a bit the lab concept that we have discussed before. But now let's go in deep to Gazelle. That is the more interesting part. So this slide is related to an explanation of what is Gazelle in a nutshell. So Gazelle is an open source web-based test platform, and vendors can validate their e-health projects to produce interface they are deploying. Just to recap a bit, is everything is okay? Yeah, I had to unmute
Yeah,
the.
exactly.
Okay. Basically, in these slides, you can see the mission of Gazelle. Of course, what we are doing in the Connectathon is do the peer-to-peer test, so two or more systems that interact to assess their interoperability directly. It's also work of group. You can have several systems interacting together in a coordinated workflow or scenario, but is used also for conformity. So you will test alone with validator tools to verify that it's compliant with standard. And this conformity part, as you can see, is no peer test. What is Gazelle? Gazelle is open source, is international, is used widely in Europe, but also all over the world. We will have a projectathon using Gazelle in South Africa next week. Is of course collaborative, meaning that we are not reinventing any wheel. We will work with existing tools, and Gazelle is able to interact with existing tools and is of course adaptable. Gazelle was born to help in the connectathons for the IG profile, but is also able to test, as I said before, project specifications and also extensions of the IG profiles. And as I said before, that is collaborative and connected. This is the ecosystem of the connected testing tools. So we have a Gazelle core and Gazelle tools, so internally of Gazelle, but as you can see here, Gazelle is also able to interact with many other tools. So we have one tool, but different system, different services. We have the test management part service that is able to manage test campaigns from the start to the finish. We have the assertion manager that is able to manage HE profile specification, assertion, and link them to the test plan in the test management. We have the proxy that is able to capture on-the-wire message exchange in order to validate the conformance of these messages. We have the security suite and the validation services and simulators. So in this hackathon, we propose you to use the tool, yes, test management. Of course, we will see it later in the demo, and to interact with the validation services. Testing event process. This is valid for Connectathon, Projectathon, and Plagathon. You have a part related to the modelization of the test plan that is initial before the event. Then you are able, before the event, or in this case during the event, to register your systems and then execute your test. And then at the end, usually only for Connectathon and Projectathon, we will have the grading and reporting. But I highlighted here in this slide what we will have in the hackathon. So this modelization and test plan was done earlier. Of course, most of the test plans of the test cases that you will see here were developed in the context of the past IG Europe Connectathon week in Vienna. Here, during this hackathon, you will be able to register in Gazelle and execute some tests. But we won't have basically the grading and reporting. We will report our results on Wednesday, as far as understood from Michael. So this will be only our reporting for this testing event. 2 or 3 slides, I don't remember how many, on the continuous testing session for EHDS. Basically, we have developed this continuous testing session for HDS in the context of the HE testing continuum. As I said before, basically in support of the HDS related project as a preliminary and preparatory step towards the IC Plagathon and maybe in the future IC Connectathon activities. And it offers both a training opportunity and a chance for vendors or organizations to collaborate with supporting between the events. And here are the logos of the 3 EHDS related projects we are working with our testing labs and that we have developed for the continuous testing session. 3 different pillars of this continuous testing session. So for now, we have put in place only the no-peer testing. We have a role of facilitator during the event also for the Plagathon. The name is the facilitator, that is a subject matter expert who help and guide the participants in the process of testing and offer guidance and support to ensure that they are prepared for the event. And we have also an online space to support the communication and collaboration that is widely used. It's also used for this hackathon, that is Zulip, basically for in our organization, not on fire, but it's Zulip, still Zulip. Of course, new things are coming. We would like to improve our continuous testing session for HDS, putting new things into practice. Like, for example, we are working on the new validators and the introduction of possible simulators. We will have peer-to-peer testing, and that's why in your session of the Finnish Data Hackathon, you won't find only the no-peer tests, but also the peer-to-peer test. And then in the future, also the possibility to have automated test case inside. So now there is the Gazelle demo. This, as I said before, was developed in the context of the IC Plagathon in Vienna, so June 2025. We have, as I said in the slide, so I can go back one sec. Not this one, this one. So these were the different services that are the different services in Gazelle actually, but we will see in this demo also only 2, the test management part and the validation services. And that's why here, and that's why here it's inserted the Gazelle test management and the matchbox that we use for validating the content. In this, at this link that we will, I think, provide also in the Teams chat here, there is the Gazelle testbed. So here we are. This is the Gazelle homepage. You can see 3 of the tools that we have seen in slides. So the test management, the validation portal, and the proxy or message capture. So for this Gazelle instance, also the validation portals require registration, but it's not like that in other instances of Gazelle. So basically here you have the on page. You can access here directly to the test execution of your system if they are registered, just like a shortcut, I mean. Here is the validation portal, and here you can find some useful links regarding the project in which you can see the logo there. Okay. Basically, the first thing you have to do to access it is to register, and we will see the process. You have some user information. I can put some of them just to maybe we can use, yes, not this one, maybe I can use this one. Okay, I don't remember. Okay, so just to go on with the testing process. Okay, this was what I would like to show you. You can insert some organization information. You can join an existing organization, choosing from this list, or you can register and administrate a new organization. If you register a new organization, you need to insert these fields. So organization legal name, short name, website URL, and then you will be automatically assigned to this organization. So you will be the owner of this organization in Gazette, so you will receive all the emails related to your organization and all the new users that would like to apply to your organization in Gazette. So I have already sort of account, a test account. So I will sign in, not with mine. Sign out. Let's try with another one that it's only on test purpose. So I'm here with test name and test surname. I would like to open the test management and access. Of course, I don't have any accepted system in this session because I would like to register a system with you. This is something that we also have done for the webinar, but we will go in deep on this. So for register, so the first thing you have to assess is, am I in the correct Gazelle session? Because each instance has different sessions, so you can assess it here. So as you can see, we have also the continuous testing session for HDS, and the Finnish health data hackathon session with a copy of this continuous testing session, but also with the peer-to-peer testing, as I said before. But you have to be sure you are in the correct one, otherwise you will be lost. And you can see here in the upper part, in this upper corner, that you are in the Finnish data hackathon. So I'm in the good one. Perfect. So I have to register my system. To register my system, I have to click on this button, registration, and add a new system. I can use a keyword, of course. Okay, this is my keyword. It's automatically assigned. Test data hackathon. System type. I will create a content creator, and I will call it Finnish Health Data Hackathon. Version is number 1. The owner is only myself because I'm the only one, but I can, of course, change the owner of the system. And I will save it. Here I can see the summary, I can change things. And this is very important, is the registration status that is still in progress because I didn't assign my system some profiles or actors that I would like to test. But in order to be able to see some tests here in Gazelle, I need to assign to my system some implementation actors and integrate in some actors integration profile and so on. So I would like to add one, and I would like, here you can choose by domain, by integration profile, by actor. and you can see here that all these items are in the same table. So I would like to choose this domain related to the format and be on the patient summary content creator, as I said before. So you see, Gazelle said to me that it has been successfully added to my system. So I can see it here. Now I would like to say that my registration status is completed and update my system. Let's see if it's updated. Okay, we see the acceptance in progress. We will see the registration status is completed and update. Okay. Okay, now it's updated, but still acceptance is pending. So I need to go to I have to change my account, and I have to be with my test session manager account because I have to accept the systems. So you see, in some cases, it can be done also by the organization owner. So the organization owner is able to accept their systems. In some cases, not. It depends on how the testing session is developed. And now I can go back with my testing account, with my test case. I can see this. This is my system. And to test, I will go here, test runs. Here you are able to see all the tests, preparatory tests that are visible here. And it should appear this one because in the testing session was assigned as all tests that need to be here are preparatory. So this is my test, is accepted. I can see here that it's content creator with the registration status completed, it's patient summary, and it's fine. So here I should see my test run. Don't know why. So this is the demo effect and don't know why I'm okay. Here I am. This is the test that I have to see. And here I am. No demo effect. Thanks God. Okay, this is the test that we need to perform. In order to perform this test, I need to go on this run button. This is only no peer test, so I don't need to choose any vendor with which I have to perform the test with. Just pressing on run button, and this is an error. Why I have this error in Gazelle? I talked too early. Okay, let's see. I don't know why. Okay. So maybe I can go to another test session. Let me try if I can go here. So let's change session. We'll see if I can show it here in the Gazelle continuous testing session or runs. We'll see why. Let me check. I can go here, and for sure here I will have some. Okay, so this is the run that I would like to show you. This is already validated, so maybe we can go here and start this again. Okay, this is the test cases that I would like to show you. As you see, it's content creator, still patient summary creator. So, some info regarding how the test case and the test run is composed in Grazelle. You have the metadata with the test name, the test keyword, the test type, the instance, so it's a number automatically assigned by Gazelle, the current status, and the changes. The description that is useful for vendors that are doing this test, and how the test is evaluated. And here, when you create a test case in Gazelle, it automatically creates a sequence diagram of this test case that is useful for the vendors, but also for the monitors or facilitator to understand what the vendors have to do to complete the test case. And you will see here the instruction. I have to update an XML or JSON file produced by my application as a vendor of the patient summary. To do it, I will click on this button and I can run. As you can see here, this is an automated step execution. So you have a JSON file that is implemented when you create a test case that have an automated step. You need to insert there the code for automating the step execution, of course, and then you will be able to run this test case, and then this error in Gazelle that I don't know why. But without the myself, this should be okay. So this was the last thing that I would like to present you. And that's it. Do you have any question on Gazelle or in the chat? I'm not sure if we have questions in the chat. No? So it seems okay. I don't know where Mikael is.
I have to go to the other room to present the hackathon chairs.
Okay, so I'm not sure which is your next presenter. It's lunchtime.
Yes.
Huh? No one, no presenters anymore. Lunch. Okay.
Mikael asked me to inform that the restaurant is available in restaurant Papa, and you need to have this fire clicker if you have
Perfect.
it.
Also, if you have the badges, this one.
Not sure whether it's what could be.
Okay. So for those in the meeting room, see you in 1 hour.
But I only know that the